to all this time over on Weebly. Just start putting terpenes, terpenoids, and Weebly, and you'll come up with this really well-written blog on simple way to understand for the non-scientist what's a terpene and how they appear and how they work in cannabis. Once I realized that I was going to have to experiment myself, and I didn't want to use butter, I didn't want to use this, I used canola oil. And I started making carrot cake. Carrot cake that uses a lot of oil so that I could dose. We figured out immediately that the biggest problem with edibles, making the own, is the consistency of the dosing. You put the oil or you put the medicated extract of some sort, whatever it is, and you put that into a food, and then you cook the food, which alters the terpene and cannabinoid profile because you've heated it to a certain temperature for over a period of time. You've mixed it with other ingredients, and when you cut a cake, how many of you have an exact amount of moisture on the edges that you have in the center? And that's why one piece will make you, whoa, I couldn't get out of bed the next morning, and the other one, I waited all night and nothing happened. Long story short, before I get to what I'm going to show you, I started, along with Stuart Smith, who is my partner and husband, researching the ways to do this and how it worked. Right about this time, somebody from Hayland Labs, which is now Steep Hill Hayland, we contacted them because we heard about the testing and what that meant. And the testing was, and it was like, wow, we're going to finally know what's in this and what's working instead of just guessing from feedback. We're talking about for ourselves still. And once we kind of got it, they were in their early days too, so we had a lot of access and a lot of time to learn from them. And once we got the fact that you could control the effect of cannabis by understanding what was in it, by understanding that it wasn't just like, oh, I tried cannabis in college and it made me paranoid. The one you tried in college made you paranoid in that dose. That it has nothing to do with cannabis as an entire group of compounds. But it does give us information for following for patterns. Well, very quickly, people were asking us to start making it, and because I have a background as an engineer, process engineer, the research is something that I adore. I wanted to start finding out how this worked so I could be doing predictive. It made no sense to try to do cakes, so I said, you know, why build people houses when I can give them the lumber to build their own house? So make the oils, make the extracts, infuse them into forms where they're perfectly dosed in such a way where everything is understood about them as much as is capable with today's technology and what we know. And then be able to find what levels of each one of the cannabinoids and terpenes work for each person. Now I want to show you. You go to the next slide, because all I'm saying makes very little sense. We're going to concentrate, keep going. We're going to concentrate on one in particular, pardon? You know what? I have it on my phone. I'm sorry. Let me put it. We're going to concentrate on THC, CBD today, because got to focus somewhere. If you get this, you'll be able to extrapolate forward. And this is, Shoot, by the way, is one of our patients' nickname. She's oh, thank you. She's a little girl who was having like 300 seizures a day, and it's okay. She was having like 300 seizures a day, and then on all the benzo, on all the terrible, horrible pharmaceuticals, no quality of life. And she was sent to us by Nate Morris, the one who originated, I guess, with Valentin X, and he said, could you please take care of these people? We don't have any medicine for them, whatever. And so we started taking care of their first seizure patient. Well, immediately it became very clear to me that I was going to have to come up with a way different way to dose, a way different way to figure out what to do when you're dealing with a 3-year-old little girl, and it's scary. So I asked them to take the process that I had to go through constantly, which is, you know, if you understand metric as a first language, it's fine, but as a second language, it's a little more complex, to understand how to figure out exactly how much THC and how much CBD is in any particular milligram. You know, if you have a milligram is 1/1000th of a gram, or a milliliter if it's in a liquid form. So we want to be able to measure down to that amount. With certain cannabinoids, and CBD in particular, people tend to be more sensitive to having the reaction without realizing what's happening. They'll talk about getting irritable and anxious and feeling, you know, out of sorts, and that's how we know we've given them too much CBD. THC, of course, depending on the particular strain and the cannabinoid terpene profile, we can tell whether it's something that's what is in there that's that's making them too sleepy, or what's in there that's making them paranoid, and we can adjust accordingly. Fortunately, there's all sorts of resources out there that you can be pointed to as patients and as consumers to help you understand about what the different cannabinoids do. Now, so here we took, this was a situation here, this is a fake one, where we had a person, let's say, who was taking, on the first strain of pineapple, it had as its, it had as its content 59.1% THC. In other words, 591 milligrams per gram of THC. That is a lot of milligrams, okay? That's a lot of concentration. The next number, I think I have it here. The next number it had 0.35% THC content in the strain as well, which meant that if for each time a person took 1 gram or 1 gram of this medicine, they were still going to get 3.5% CBD as well. That was not enough CBD if you're treating somebody with THC and CBD. So we can make our own 50-50 by taking different strains, or we can take, if it's a 20-30, or let's say it's instead of a 50-50, it's a 40-60, or it's a 1-2. However we're doing the measurement on the THC and CBD, by knowing the numbers of your CBD dominant strain and knowing the numbers of your THC dominant strain, and then knowing the other number, you can figure out how much residual you're getting. And I'll tell you in a minute why that matters in our experience up to this point. So in the second strain here, which is AC/DC, in this particular one, it had 589 milligrams of CBD, but it still had a residual of 24 milligrams per gram of THC. Now, if you're dealing with a child that has a seizure disorder and they are hypersensitive to THC, that may be just enough to cause that child to go into seizures. That might be just enough to make it where the CBD that we give them, it has to be, some children, some adults too, but children in particular, they'll be somewhere around the range of 0.04% THC to less than 0.1% THC is all they can possibly tolerate. So that's why it's so important to know that second number. I have people that come to us all the time who say, well, I've got this really high CBD oil and blah-da-da-da-da, and I'm like, well, what's in it? Well, they said it's high CBD. I said, but what else? And once I forced them to go back and bother whoever the provider was, so many times it turns out there's 14% THC and 23% or 26% CBD, and they call it a high CBD strain instead of a blend. Person's giving all this THC at the same time and doesn't understand it. That gets us into the need for, of course, labeling and regulation and full disclosures, and and testing, and that's a whole nother discussion. But in this case, we had to make a determination. How many milligrams in a day do we want somebody to have of, this is a cancer patient particularly. This one, this is an example I threw together for a conference, but this was a woman with breast cancer that had responded better to CBD, we are assuming it's because of the ID1 pathway, the ID1 on the RNA that causes it to tell the cells to reproduce more aggressively. I'm not a doctor, I'm not a scientist, so not technical. Everybody else can say she does not know what she's talking about. But by dividing this right here, right too, just to go back to it, we're able to tell that if we want this person to have 200 milligrams of THC in a day and 300 milligrams of CBD, they can take 0.318 grams of the pineapple and 0.507 grams of a quarter, in other words, about a half a gram of CBD of the other strain, and that will give them that. We tell in the whole day. And then we break it down again to show per dose. So in this case, it would be 0.10, which, if, for those of you that have heard of things like the proverbial grain of rice, we say the proverbial grain of rice is between 0.04 and 0.06 or 0.05 milligrams, grams. So in this case, if it's 0.10 on the pineapple, this person would be taking 10% of a gram. Pardon?
You're talking about the oil, the black oil you're talking about?
Yes, I'm talking about on one where there are 500 and
so
some odd milligrams.
Like the oil.
Yes, yes.
I think some of these people, it's good to tell them what you mean by that with the rice grain, because I don't think everyone understands the rice grain thing.
Oh, I apologize. Thank you so much.
I think the rice grain, they're like, okay, what did you tell
Sometimes I got my head so down in the details, I forget to, you know, sorry. It's like, you know, let me tell you how to build a watch instead of what time it is. Thank you so much. I really appreciate it, Jason. Okay. What were we talking about?
The rice grain.
There's been a movement for many years that many people have heard of called Rick Simpson and Rick Simpson oil, and it's about taking a gram a day, 60 grams in 90 days, and curing any disease you've ever had. And that has been a mass movement for many, many years, and because of the luck of the draw, some people have gotten better from it. It's, you know, lo and behold, it works. That is the miracle of cannabis from the standpoint that you can really do very little to mess it up. You know, it's not like, you know, taking an opiate where you take a few milligrams too much and it can be fatal. So at least we have a little wiggle room to learn this as a democracy, as Martin said. Now, what they were doing is they were taking approximately a pound of cannabis flowers and through a distillation process or extraction process, breaking that down to the essential oil, which contains only the cannabinoids and terpenes, all the compounds that are in that, nothing else, other than maybe residual from something else. Now there's also there's other compounds in cannabis besides cannabinoids and terpenes, but basically it's all plant that's left, and it's just down to the essential concentrated extract. Like one of those things where you'd add 1 drop of vanilla extract to flavor an entire thing. It's like that versus having to stick in a whole ground vanilla bean.
Can I throw my things? So I'll break it down in layman terms. So if it comes out, it'll be in an oil form. So it looks like a syringe that you shoot yourself with, but it's not. But it's a syringe that has a black oil that's very concentrated. I'm trying to get them to picture it. So when she means a rice grain, it comes out like you're supposed to, like you're saying a dose of rice grain, a size of a rice grain, because the way it's concentrated is how you take it. All you do is put it on your mouth. So what
let me go into that. The rice grain is yeah, right, the rice grain, how about that? But these are really big rice grains.
Big rice grains.
Yeah, the rice grains are important because not everybody has a jeweler scale that goes to 0.001. So if you're going to have to eyeball it, you can eyeball approximately that. What we do at Aunt Zelda's is we are here, we care about the research. So we make everybody have a scale and weigh it. What this does is it gets, instead of having to, if you need a gram a day of cannabis, instead of having to, on let's say a 30% THC strain, let's say that would be 30, you'd have to have help me with my math, 200, come on, Kim Ron, you can do this.
What was it?
If you have
30% is
30%.
milligrams per gram.
Right, but if you, yeah, so you'd have to eat a lot of raw and it wouldn't be decarboxylated. So let's say there's residual, I know it's going too technical. Okay, let's put it this way. If you got to take a lot of it, it's the best way to get it in, okay?
The more you're taking, the better, but then you
Yeah,
have to,
it's concentrated.
But you have to build that tolerance, because if some people,
Right.
some people
Now-
start off too much.
Yeah, that's a whole different discussion. Okay, I want to go real quickly, just one more, if you don't mind, go.
Sorry, Mike.
Because I got completely, keep going. This was a man that came to us with, one more, with hypertension. And he was at a point where he was about to become completely disabled, have to go off work. And he was in his early 50s. Now, the reason I wanted to show this to you, and I apologize that it's hard to see, is we started him out with one strain, and we, like rarely happens, nailed it right away. But then we couldn't get any more of that strain. So what do? We take the profile, in this case, the first one, which was cotton candy, which had 0.6% THC and 0.26% CBD, and we recreated that, built it with 2 other strains. So it's like you can MacGyver cannabis to pick and choose the different things that you need to recreate. So a lot of times when people go into dispensaries, they're overwhelmed because last time they were there, Blue Dream had this number, and last time they were there, they were able to buy ChemDog, and this time there isn't any. Well, you can look at the numbers, and you can create your own mixtures. In this case, this man has been successfully since 2011 working, promoted, controlling it, and we've been able to do it with multiple strains. The elderly are much more sensitive to cannabis than the young as far as the dosing. They have to start at much, much lower doses. With anybody over 55, 60, it's just you have to really start much lower. With children, it tends to be a much higher tolerance. We have ways of adjusting with acetylcholines and things like that to help to mitigate some of the side effects of cannabis. But it's so many drugs in one, and the way that you heat it and the way that you pick it and the time of day that you pick it can make a difference in what the resulting drug is. And this is a science that I can understand why the medical community is kind of leery to take on, because I don't think in a lifetime any person could ever learn all there is to know about this plant. Thank you.
Mara Gordon, everybody, thank you so much for your insight. Before we take a break, we'll be here, commercial break. I thank our sponsors at Harborside and Magical Butter. And when we come back, we'll be hearing from Dr. Minahan and Jason David.
My son was born on August 17, 2006. And you can only imagine the dreams that I had for him. Christmas morning, 4 months after he was born, he had his first grand mal seizure.
So how's everything going?
Jaden had 4 days without a seizure. He was having seizures on an everyday basis. I have hope. You know,
That's awesome.
The last 4 days have been the best 4 days I've had in the last 4 years.
Welcome back to Awaken America. I'm your host, Paul Trowbridge. Earlier we heard from Reverend Dr. Kimron DeCesar and Mara Gordon and Mr. Martin Lee. Now we're going to hear from Dr. Minahan. All yours.
Thank you. First off, I got to do this and get this out of the way because I don't want to forget this, that I have a daughter who's doing well, and thank you. because of what you did, I have a kid who's like phenomenal. I appreciate it. Gutsy, because I wouldn't go into a dispensary. You know, I've got more guts than me.
You saw me on the first time when I did it. I was gonna
So just for a little education thing, marijuana is Schedule 1 on a federal level. It's illegal. No medicinal value and high instance of abuse. You wouldn't be here if you believe that to be true. So it's in the same class with heroin and LSD. Marinol, which is synthetic THC, is Schedule 3, which is in the same class with Vicodin and Norco, which most people know about. So I can write for Marinol as a physician because I have a DA license, but you add the rest of the plant to it and it's illegal. So kind of goofy. Is there a slide? Oh, here you go. Good looking family. All right. So they said I could put up whatever picture I wanted, so we're gonna go through a bunch of family pictures, vacations and stuff. But that's my crew. It's my daughter in the middle holding the dog. She's 11. I gotta preface this. I'm a father of 4, married once, conservative. I bet no one in here is more conservative than me. No way. All right? Anyway, I'll leave it at that. You go to the next slide. So this is me at work. And I'm an ER doctor. I've been doing this for about 20 years. I see drugs. I see them used and abused. A year ago, marijuana was in that same class. It was a ruse for recreation. So you go to the next slide. So my daughter Mallory started seizing at 14 months. I thought I knew seizures. So we started her on Keppra with the Lamictal, lamotrigine. We went through all the drugs, about a dozen drugs. I have a lot of video of her over the years because I teach. In fact, on the way here, I stopped at a medical center and taught about epilepsy and, of course, mentioned marijuana, educated them. So anyway, seizing about 30 to 40 times a month. This is last August, 12 times in a night. And then last springtime, most of her seizures were at night, so it's probably safe to swim, but it pulled off the bottom of a swimming pool. Pretty disheartening. Did the ketogenic diet, looked at surgery twice, and we're doing the ketogenic diet. Now, I live in Los Angeles. There's not much further place away than Baltimore, Johns Hopkins, but it was the best place for the ketogenic diet. So every 3 months, we got on a plane for a 1-hour appointment. But I wanted to do the best I could for my daughter. Money was not an issue. So you can go to the next one. So this is her getting a video EEG, preparing possibly. Is she a surgical candidate? Turns out she wasn't. And she'll go here. She's seizing here in a second. So we fly to Baltimore last summer, and she seized 5 times, twice on the plane, 1 at security, and then 2 in the hotel. And the expert at Johns Hopkins says, you could try cannabis, but there's no studies. Let's try Felbutol. Felbutol causes side effect called aplastic anemia. It's deadly in 20 to 30% of the people. I knew it was toxic when he said it. So I said, no, I'll redo all the dozen drugs we've done before I do Felbutol. But let's look into cannabis. But that's a stretch, okay? So, and I actually thought, does my kid smoke it? And I actually, don't judge me, okay? But that's the way I originally thought, does she smoke it? So finally, I only started her on it. Just went 4 weeks with 1 seizure from 30 to 40 a month. I mean, I think she's a success story. She's back in school for the first time. She was usually a pretty quiet kid. She gets in the car for church one day, she jumps in, looks around, she says, good morning, how is everybody? I got my kid back, so. Go to the next slide if we could. So I'm a physician. I go to these medical conferences. You spend like $500. You fly across the country, buy your own hotel and plane and all that stuff. And you sit at these conferences. And this is a medical conference, okay? Go to the next slide. And this is where I think we need to do some changes. Here's another medical conference. Some are kind of dry, but you learn some interesting stuff. And go to the next one. They have these expos at the medical conference. You get to go around and talk to the drug reps. And they're kind of giving you their slide of the medicine. But you get free pens. That's pretty cool. But you go around, and this is a typical medical conference. It'll cost me probably about $1,000 to attend one of these. But you must attend medical education. It's part of what we do. So if you're a politician and you look up medical marijuana, go to the next slide. So Kush Expo, medical marijuana show. Okay, play the video. If you got the kids, hide their eyes. This is a little different than any conference I've been to when you talk about medicine. Looks like fun. But imagine you're a politician. How do you take this seriously? You're a physician. How do you take it seriously? And that becomes an issue when you're trying to get a guy I know from the House of Representatives, one of the 300 and some guys, he says the House of Representatives is so conservative, they will not move this issue from 1 down. And when you see this kind of stuff, I get it. I know it's hard to convince them. You can go to the next slide. So once this works for my daughter, and it's wrong not to share it, so I end up sharing. This is Lou Correa. He has a bill going through Sacramento right now, 1262, which is trying to make this more medicinal. And I agree. Within talking with the guy and telling my daughter's story, within a couple minutes, he was on board. Yeah, this is for real. There is medicine in this. So go to the next one. This is Kevin Chang, works for Dianne Feinstein, met with him last week. I'm trying to play the angle of, there is something here. For some of these politicians, it's political suicide to move it from Schedule 1 down. All right, they like their jobs. All right, you can go to the next slide. So the guy on the far left, does anybody know? Focus on the Family, Jim Daly. If you know Facebook, 1.7 million likes. Okay, not a small organization by any means. Pro-family Christian organization. Spent the weekend with them. And I was mentioning my daughter. He brought up cannabis, so, which was awesome. So, he's on board. So it's a process. I need your help with this, if we could. You can go to the next slide. And that's my daughter, Mallory.